student was held face down in a school parking lot by several staff members. Another child who was placed in seclusion was instructed to use a bedpan in order to urinate and defecate. Restraint and seclusion used in the school system should not be used without the assistance of trained staff as well as medical personnel. Just imagine being notified that your child had received a fracture while in a restraint. Today I'm going to explain the importance of State Bill 00927 in the prevention of the use of seclusion and restraint within the school system. This is just an example of the incidents involved in some students in some school areas. Today I'm going to inform you of the definition of restraint and seclusion and the reasons why they're not appropriate to use. I'm also going to discuss the physical and psychological damage that can occur with individuals who are placed in seclusion and restraint without trained staff. Last, we'll discuss the training that needs to occur with staff and medical personnel involved in seclusion and restraint. So there are specific definitions of seclusion and restraint, and we need to understand those definitions in order to understand why these must be utilized as a last resort. In 2004, Ryan and Peterson defined restraint as any physical method of restricting an individual's freedom of movement or normal access to his or her own body. Seclusion is defined as the involuntary confinement of an individual alone in a room or an area from which the individual is physically prevented from leaving, according to Valancourt and Klotz in 2012. There are times when restraint and seclusion are appropriate to use. However, there are also times when they are inappropriate. In a risk management guide in 2006, Hamowitz, Erf, and Huckshorn stated restraint and seclusion must only be used in emergency situations to ensure physical safety of the child and all others, and should never be used for purposes of discipline, retaliation, or staff convenience. In 2015, Samuels reported the Ohio State Board of Education prohibited the use of seclusion rooms or physical restraint as a punishment for children or as a convenience for staff. Now that we understand the definitions of restraint and seclusion and when they are appropriate to use, we're going to look at the physical and psychological damage that can occur, especially when they are performed by staff without training. So, physical and psychological trauma involved in those who experience restraint and seclusion can be devastating. In 2010, Stern reported that restraint and seclusion have their own risks because restraint can involve physical struggling, pressure on the chest, or other interruptions in breathing. Risks include serious injury or death, re-traumatization of people who have a history of trauma, and loss of dignity and other psychological harm, according to Hamowitz, Erf, and Huckshorn in 2006. There is a lack of training in the school setting with seclusion and restraints. In 2012, Valancourt and Klotz reported there has been an increased debate regarding appropriate staff training, proper seclusion and restraint techniques, monitoring and parent reporting, and when, if at all, these methods are appropriate to use in the public and private school settings. There is also a headline in Austin, Texas, where American Statesman staff stated that a 14-year-old boy died after being restrained in a classroom by his teachers. At a preliminary autopsy, the child succumbed to an intense amount of pressure to his chest, according to Ryan and Peterson in 2004. So now that we can see the psychological and physical damage or trauma that can occur, we are going to look at and discuss training that needs to occur with staff as well as any other personnel involved. The school system needs to implement ongoing training for all staff involved in restraint and seclusion, and medical personnel needs to be available for consultation. In 2014, OSHA reports that the knowledge base should include an array of evidence-based approaches, including trauma-sensitive approaches, positive behavioral intervention, and supports, social emotional learning, appropriate staffing ratios, and staff training on stress management, implicit bias, and ways to prevent problem behavior from escalating. Further, OSHA states that although it can't reduce all troubling behavior, a sound preventive foundation can reduce its incidence. So medical personnel must be available in order to assess a medical history and evaluate the student who is placed in restraint and seclusion for the possibility of physical complications. According to Hamowitz, Irf, and Huckshore in 2006, patient assessments to identify medical risk factors for death and injury, such as obesity, respiratory disease, cardiac anomalies, medication issues, recent ingestion of food, prone positioning, and past history of trauma. Further, a physician or an individual licensed practitioner must conduct a face-to-face assessment with the individual as soon as possible, which cannot exceed 1 hour. So in conclusion, we can see the importance of preventing seclusion and restraint in school systems without the proper training of staff, as well as not having medical personnel available within the school system. We do know the definition of restraint and seclusion, and that they are important to understand due to the potential damage that can occur to a child. We also know the psychological trauma that can result with those who experience restraint and seclusion. So staff must receive, at a minimum, annual training over verbal de-escalation techniques, trauma-informed care, and stress management. Also, a trained medical consultant must be available to assess a student after restraint and seclusion, which includes knowledge of medical history and conducting a face-to-face assessment of the student. So don't be the parent of the child who endures physical trauma or psychological trauma due to restraint or seclusion within the school system. So I do urge you to contact your local school board members in hopes of initiating this type of policy.